Hi, thank you guys for coming to my speech today. My name is Jessica. You want to introduce yourselves?
Yes, I'm Dan.
Natasha.
Mindy.
All right. Again, thank you so much for joining me. Today we're going to talk about why addiction treatment is necessary. We have a huge epidemic right now going on with opiate addiction. There's been overdoses that you're constantly hearing on the news, in the papers, on Facebook, whatever. And I'm just going to go over why treatment is necessary. I know some people tend to think that you can just stop using, but that's not the case. So what addiction is? The technical definition of addiction is the state of being enslaved to a habit or practice, or to something that is psychologically or physically habit forming, as narcotics, to such an extent that its cessation causes severe trauma. Drug addiction is a chronic, often relapsing brain disease that causes compulsive drug seeking and use, despite the harmful consequences to the drug addict and those around them. Addiction touches a lot more people than we know. It's almost everyone you talk to, they know someone that is related to someone that suffers from addiction or has been through addiction themselves. The big debate is if it's a choice or a disease. A lot of people that are uneducated don't think it's a disease. Some people think addiction cannot be a disease because it is caused by the individual's choice to use drugs or alcohol. While the first or early stage use may be by choice, once the brain has been changed by addiction, most experts believe that the person loses control of their behavior, which is often the case. I mean, you get off work, you go to happy hour and have a beer with a friend. That starts out as social use. And then over time, if it gets worse and worse as far as consumption, it chemically changes how the brain works. The parts of the brain that are affected is the cortex, the limbic system, and the brainstem. I did bring a diagram for you guys to see that kind of shows the parts of the brain that are affected. The brainstem, which controls basic functions critical to life, such as heart rate, breathing, and sleeping. The cerebral cortex, which is divided into areas that control specific functions. Different areas process information from our senses, enabling us to see, feel, hear, and taste. The front part of the cortex is frontal cortex of forebrain, is the thinking center of the brain. It powers our ability to think, plan, solve problems, and make decisions. The limbic system, which contains the brain's reward circuit, it links together a number of brain structures that control and regulate our ability to feel pleasure. Feeling pleasure activated by healthy life-sustaining activities, such as eating and socializing, but it also activated by drugs and abuse. In addition, the limbic system is responsible for our perception of other emotions, both positive and negative, which explains the mood-altering properties of many drugs. That's more or less just a description of everything, those parts of the brains and how it's affected. Addiction treatment can include medications, behavior therapies, or a combination of both. It can be done in group therapy, it can be done in individual therapy. Medications are good as long as it's in conjunction with group therapy because it goes along with coping skills and basically learning a whole new way of life. This is another diagram that I have. This is what treatment can include. It can include childcare, it can include job services, life skills. There could also be coping skills, communication skills. A big thing with when you're using is you don't learn how to communicate correctly. When you start using, your brain stops developing, so you often get stuck in that age frame that you were when you started using. There's lots of benefits to treatment. Having medication to treat chemical imbalances in the brain, learning coping skills, increasing sober support, learning to change overall way of life, being educated on the effects of drugs and alcohol, improving decision-making skills and through processes, and learning a whole new way of life. with addiction comes criminal behavior. So when someone gets arrested because they're stealing to support their habit, or they were caught in a drug deal, whatever the case may be, they get arrested. Which treatment is a way better option as opposed to incarceration. Incarceration, they go in, they're incarcerated, they do not learn any rehabilitation skills on how to change their life. So they get out of jail, they go back to the same behaviors because that's what they know. Doing treatment as opposed to incarceration allows them the opportunity to change their way of life, to make better decisions. One of the statistics is 1 in 36 addicts have a chance at long-term sobriety. That's not very good. So having treatment available and going to treatment, it improves those chances. With addiction being a disease, it's along the same lines as diabetes, hypertension, asthma. It's an ongoing disease that requires constant care. For the percentage of patients who relapse for type 1 diabetes is 30 to 50%. For hypertension is 50 to 70%. And from asthma is 50 to 70%. For drug addiction, it's 40 to 50% that relapse. Those are the ones that were able to obtain some type of period of sobriety. Not everybody gets that opportunity. Treatment definitely increases that. And these statistics were from National Institute of Drug Abuse. But in conclusion, the drug addiction is a chronic brain disease that requires extensive treatment. Addicts are human beings. They don't want to live this miserable life that they're living. But it's so hard and so much work to get out of that using in the lifestyle, plus they're unsure how. Going to treatment gives them the opportunity to change their way of life, to have that opportunity to not be miserable anymore, and it gives them the sober support and the healthy environment that they need. So hopefully with this, you can understand a little better why addiction treatment is necessary and why it should be opted over incarceration. You guys have any questions for anything?
Yes, you talked about hearing drug addiction. How about alcohol?
Alcohol is a drug. It is still a mind-altering substance. A lot of people don't see it as the same thing. In fact, alcohol is worse. Alcohol, you can actually die from withdrawal from alcohol. You are physically, chemically dependent to it, as opposed to like cocaine. That's more of a psychological dependency. Alcohol is chemical, but alcohol is 100% a drug.
It's good to know.
What about different types of treatment? Is there for different stages?
Yes, so same thing with drug addiction. There's different levels as like diabetes. Some people, they just need to have insulin on hand if they need it. Some need constant insulin. Some need around the clock care because it's gotten to that point. With drug addiction, it's the same thing. You can do 1 hour a week of outpatient treatment. You could do 2-3 hours a week, which would be a traditional outpatient. Intensive outpatient would be anywhere from 9 to 20 hours a week of treatment. And then there's detox, which would be around the clock medical detox to help you get through the withdrawal and the being sick safely. Partial hospitalization is usually around 1 to 2 weeks, and that's all day of groups, and you learn so much information it's almost hard to remember everything. And then of course there's residential treatment. So with the same thing as any other disease that's ongoing, you need different levels of care at different times. All right.
So what would the main thing you would tell someone that was certain that they just wanted medication treatment as opposed to counseling?
I would let them know that medication definitely helps as far as not feeling sick, balancing the brain chemicals, kind of blocking cravings, but life is still going to happen. Whether it's a relationship that ends, or the death of a loved one, or you lose a job, or financial issues, there's still going to be stress, and you need to learn how to handle those stressful situations to prevent relapse and going back to those old ways.
So you mentioned diabetes. Isn't it correct that diabetes can be early onset of diabetes? If change your diet and exercise that you can kind of go below the diabetes cross line? Can you do that with addiction?
Well, it's the same thing. That diabetes is still being treated because you're changing your diet, you're changing your exercise. With addiction, you are changing who you're going through the treatment and you're treating it every day. You're watching who you're hanging around with, the situations you're putting yourself in, how you're handling situations. So it's sort of along the same lines. It's that constant attention that it's going to need every day for the rest of your life.
So how about use and abuse before I really get, what's the word they use, strung out on drugs or alcohol?
So use would be social, where you're not really getting any type of intoxication. It's just moderate here or there. With abuse, we'll use alcohol as an example. You're going out and getting drunk every weekend. You're abusing alcohol. That's no longer social use. And then if you're drinking 3 days in a row, then it leads to 4 days, 5 days. Now your body needs this in order to not be sick. So that's where that difference will come into play.
But I also read that you can drink a couple times a year and become an alcoholic.
Depending on what extent you're drinking, it can change the brain chemistry, yes, to where your body's going to constantly crave that alcohol, which in time, disease is progressive. So you can start out drinking little by little, and then the more often, the more you consume, your brain is changing, and it's going to require, it's going to tell you you need more, and that's when you become dependent on it, because it'll progress over time.
You mentioned levels of care. So if I come to you and just starting to get a little problem with marijuana or alcohol, would you give me 9 hours of treatment?
Well, with your criteria at that point, it would be more education. So you can learn about what you're doing to yourself, what these drugs are doing, how you can have fun without using them, that type of thing.
And then the extent where I progressed, my disease progressed, and you mentioned I had to go inpatient. I have medical insurance through the state. Will they pay for everything?
Yes, insurances do cover to a certain extent. With Medicaid, I know right from the jump, they'll typically cover 5 days of detox and about 10 days of partial hospitalization. And then you can follow up with aftercare, which would be anywhere from 1 to 20 hours a week.
So you would recommend that once I come out of the inpatient for 15 days, where would I go to for the continued care?
Any outpatient facility.
And normally, where would they place me?
Everything would be based off your personals. Typically coming out of a partial hospitalization facility, you're going to go directly into IOP. Because if you met criteria to be in a level that high, then you would need more than 1 hour a week. 1 hour a week's not going to do nothing for you.
And IOP is what?
Intensive outpatient. That would be the 9 to 20 hours a week.
Then you would just step down through the different levels.
Yes. So you step down as you get better and you're learning to cope more with life, then your treatment would decrease. If you start slipping up, just as if you're with diabetes and your sugar's high, you're going to need a higher level of care. So with addiction, it would be the same thing. You would go back up.
And what is involved in this IOP?
It's a lot of group therapy. You learn everything from life skills to anger management to what coping skills to how drugs are affecting you. A little bit of everything. Because really, a lot of reason why people start using is because they're trying to drown something out. Whether it's a rough day at work, I need a beer. Or my kids are driving me crazy all day, where's my glass of wine? It's to try to relax yourself a little bit. So you'll learn different, healthier ways to handle situations. As small as that, or as big as something catastrophic in your life.
Well, how would you know if there's anything that I'm using?
we do your analysis. Your analysis are definitely done in treatment, because that's how we measure the effectiveness, if you're using still or not. Well, thank you guys very much for joining me.
Thank you.
Thank you.
Yeah.